Leptospirosis. Sounds exotic, right? But it's a real threat,
Exactly. It's a bacterial infection spread through contaminated water or soil.
Wow, 1 million cases globally yearly. Scary numbers.
Yeah, and almost 60,000 deaths annually. Prevention is definitely key.
Right. So let's talk about the symptoms. What should healthcare providers be on the lookout for? So it starts with flu-like symptoms, right? Fever, muscle aches, headaches, the usual suspects.
Yes, but it can progress to Weil syndrome. That's the life-threatening part.
Right, Weil syndrome. That involves internal bleeding and kidney damage, I understand.
Exactly. And jaundice is a big indicator, yellowing of the skin and eyes.
Okay. What about diagnostic tests? How do we actually confirm it?
Blood and urine tests are crucial for detection.
So blood tests show signs of the infection, and urine tests show the bacteria itself?
Precisely. And for severe cases, imaging like chest x-rays or CT scans may be needed.
Okay. Treatment involves antibiotics, of course. What are the usual choices?
Well, we typically use doxycycline, amoxicillin, ampicillin, penicillin-G, or ceftriaxone.
And hospitalization for severe cases? What kind of supportive care is needed then?
Yeah, mechanical ventilation might be necessary if the lungs are involved.
I see. And plasmapheresis to reduce the risk of organ damage?
Exactly.
So prevention is obviously vital. What advice do you give patients?
Avoid contaminated water, for sure, and wear protective gear when handling animals.
Good advice. What about the prognosis? What can patients expect?
Most cases are mild and resolve without treatment, thankfully.
But severe cases need prompt treatment to avoid complications, right?
Absolutely. Early intervention is critical for a good outcome.
Who's at higher risk of getting leptospirosis?
People living in or traveling to tropical or warmer climates.
So places like Oceania, the Caribbean, parts of Africa, Latin America, and Asia.
Yes. And recreational water activities increase the risk, especially after heavy rainfall.
Makes sense. Flooding events can lead to outbreaks. Important to remember that. How is it actually transmitted?
Primarily through contact with infected animal urine.
Direct contact or through contaminated water and soil?
Yes, and ingestion of contaminated food or water is another route.
Okay. And person-to-person transmission is rare?
Very rare, yes.
How do we manage mild symptoms?
Over-the-counter pain relievers and fever reducers can usually help.
When should patients seek immediate medical attention?
If symptoms worsen, or if there are signs of Weil syndrome, definitely.
What are some key questions to ask patients?
Exposure history is important, symptom onset, and the severity of the illness.
Any additional advice for healthcare providers?
Stay updated on the latest guidelines and treatment protocols. Things change.
So leptospirosis is a serious but preventable disease.
Early diagnosis and treatment are really crucial for a good outcome.
Thanks so much for this informative discussion. I really appreciate it.